Hey, everybody, welcome back. I'm joined here today with Dr. Kyle Klute from Omaha, Nebraska. He's the owner of Good Life Eyecare. He's also a consultant with Practice Performance Partners, helping other ODs grow their practices, and looking forward to jumping into all of that. One of the ways he also came across my radar was his podcast on iCode Media called Book Nerds that he hosts with friends Dr. Brianna Rue, who's a friend of this show, and Dr. Aaron Werner. So maybe we can dive into a bunch of that. But first, Kyle, welcome and thanks for taking the time to chat with us today.
Yeah, thanks, Aaron. Thanks for the invite. Looking
Yeah,
forward to
yeah,
it.
you bet. So talk first about a little bit about, how you evolved into this whole idea of Good Life Eye Care. And I think you do quite a bit there with, I mean, you have some medical specialty, I know. Did that start
Mhm.
out as a like more traditional practice, comprehensive care, and then grow into the
Yeah,
medical, or how did you find yourself and like evolve that practice to get to where you're at today?
yeah, that's a great question. So, how that evolved or how that came to be is I graduated, not to go back too far, I'll try to make it quick, but I graduated in 2013. I did a disease residency, and I've written about this in an article in the past, but basically, my goal coming out of residency is I was the disease guy. And my goal, honestly, it sounds embarrassing to share right now, but my goal was not to fit a single contact lens and not to see a single pediatric patient in my career. And I accomplished that quite well for the first about 3 years of work. I worked at a disease referral center, so just patients were referred with lots of glaucoma, dry eye, bad infections, neuro, those types of things. But what I found is that I really desired, as an optician before I went to optometry school, I really desired to be more in primary care. And I just got the itch to take that medical specialty, that expertise into the primary care realm. So that's kind of how that was born out. As I don't necessarily, I know these are just a difference in definitions and terms and jargon and that, but what I think is best for our practices, the majority of practices and the majority of our patients, is if we could not think of some of like dry eye, myopia management, and those things as specific specialties. But if we start to think and retrain our minds to think of those things as just the base minimum of what we do, all of us do as optometrists, because a lot of times when we kind of say, well, only if you do dry eye, you're a dry eye specialist, or if you do a myopia management, you're a myopia management specialist, or if you do glaucoma, you're a glaucoma specialist. That can kind of sometimes psychologically take us off the hook in thinking that we need to manage those things extensively with our patients, and then we tend to get into this habit of referring, kind of detecting those conditions and referring them out of our practice. But my goal for my practice, and since I've been successfully building that for the last 5, 6 years at our locations, is to do all those things in house. So I feel like, for myself, I'm responsible for the totality of my patients' eye care and visual development. So unless a patient needs surgery, they're not going to leave my practice. I'm going to try to take care of them to the extent of that my scope in Nebraska and Iowa allows. And so that's what I've been doing with consulting as well, as we've developed specific metrics, we call them medical metrics, to basically help other optometrists do the same thing. So, how do you create a system in your office to manage all those things under one roof in more of a comprehensive way? So primary care, comprehensive optometry, that's kind of what we've built there. And so, yes, it didn't start out as that. Good Life Eye Care has been around for about 5, 6 years. We started with kind of a cold, warm start, I would say, about 5 years ago at one location in Omaha. And then 2 years ago, we purchased our second location, which was a 70-year practice across the river in a small town of about 6,000 people in Iowa. So that's kind of the genesis of all of that and kind of how we came to be.
Okay, very cool. So I have to suspect that along that way, like during that evolution, there are some there are some areas where you have to like, make some concessions because like some of these things we talk about in the different specialty realms that you listed are, you've got the tools already, and then you just need to develop the knowledge and like protocols on how to handle those things as they're running through your office, right?
Yeah.
And some of these things require some extensive medical or like equipment upgrades as well, right? Or
Hmm.
like equipment that you don't
For
have.
sure.
So do you kind of work that into this whole like a transition process of say we have an OD today who has only started to say dive into one of those, like they're doing a lot of myopia management or they're doing a lot of dry eye and they've,
Mhm.
they've invested in the IPL, right? Or something like that.
Yeah.
And they're at that place and they're looking to continue down that path, but just not sure like when do we bring on these other pieces of equipment and what are protocols when we're not there yet to still be labeled fairly comprehensive if we can. Does that make sense?
Yeah. Yeah, absolutely. It makes sense. Yeah. So let's take dry eye, for example. A lot of doctors see that as a specialty because I think primarily because the equipment can be expensive, as you alluded to. Like, to go out and buy an IPL, it's going to take 50, $60,000 plus, much more than that if you're going to get a combined unit. If you're going to get some sort of thermal pulsation device, it's going to be, on the order of 5 to 10 grand or something like that. And so we tend to think of these things as like, well, that I can't actually provide that type of therapy for my patient because I don't have that in my office. But the reality is you can start really small, and that's what we like to do with our clients, with the optometrists that we work with, is especially for dry eye. Where I started in my clinic of kind of like I said, it's kind of like a cold warm start. We purchased a practice, but it was a practice that they saw about 15 patients a week is also. It was very, it was a practice that needed some to jump in and dive in and needed a doctor to be there full time and pick it up. So they had a little bit of a loyal patient base and all that, but we've had to grow it tremendously since. So similar to a cold start, but we just didn't have the resources. So I started knowing, like, I came from a practice where I was able to be the dry eye specialist. So I knew, like, I started with kind of the end in mind. I said, and this is how we try to work through every single problem is, hey, what one or two treatments do I know I can use in my practice? And for me, it was, oh, I know I can prescribe topical steroids. Okay. And I know I can prescribe cyclosporin. And I know that I can do plugs. I'm not going to be able to provide thermal pulsation because I don't have the money to buy that. I'm not going to be able to provide IPL because I don't have the money to buy that. But I can still build a dry eye practice because I can sell them omega-3s or warm compresses. Those are things that I can have in my inventory. So what do I need to find at the front end at the annual exam? Like, what one sign or symptom do I need to find at the annual exam that would lead to a diagnosis of dry eye and further lead to a treatment with topical steroids? Or what do I need to find that is a diagnosis of dry eye that's going to lead to a successful treatment with punctal plugs? And that's where you start. You can start very cheap, and then once you have that and then you have them back 1 month later for a medical evaluation and you get used to billing 99 codes and utilizing the medical insurance, then you're going to start building a dry eye practice. And then you have, like, if you do that for 1 or 2 years, you're going to be able to look back and have like a lot of data to look back on and say, hey, I did 3 dry eye evals a week. And that gives me, let's see, 150 patients. So if I were to convert 30% of those 150 patients to IPL, would that pay for itself? And probably likely so. So that's how you do that, is you just start small. You don't have to. I think the mistake we often make is we buy the widget, we buy this fancy piece of equipment, and we think that it's going to sell itself, but it still takes your gumption and your process and your protocol to drive people towards that.
Yeah. No, that's great because I've seen that in different instances too. Like, buying the widget and whatever it is, IPL or whatever it may be, and it's just not coming to fruition, or maybe not at least coming to fruition as fast as what they thought it would. And so it's great to know, like, and I've always been a big proponent as well of building up a base of like making sure you know what your demand is first, for lack of a
Yeah,
better term, right? Or make sure you're handling cases in your
yeah,
demographic and in your practice that are going to support this big investment. And
yeah,
sounds like you can definitely do that with some of the protocols you've started to outline there with very, very cheaply and just with processes as opposed to investment and
yeah, for sure.
monetary investments. Good deal. Good deal. That's great insight. What are so as you're going through, your practice evolution, like, is there anything outside of that? Like, I usually ask about what are some of the toughest challenges you faced from like the start, let's call it from the start of your what are we referring to it as your lukewarm start? your,
Yeah.
your lukewarm start
Yeah.
to where you're at now. I mean, like, has it been that evolution and building the protocols for that, or would you say there's another challenge that was fairly tough but meaningful for you to overcome?
Yeah, that would be definitely when we purchased the second location. So
Hmm.
what I found is, and this could be my own weakness as a leader, I'm totally willing to admit to that. But what I found in scaling, the difficulty of scaling, I think that's probably, how many books, how many business books are written on that topic alone. I think that's a very difficult thing. And I've felt and lived that for the last 2 years since we purchased the second location. The difference was the first location, like I said, is almost like the reason I say it's kind of a lukewarm because we were actually able to come in. There was no staff there, previous staff. It was basically just kind of a shell. And so we were kind of able to come in at a pretty cheap price and start from scratch, our own brand and everything. So it was really our baby from the start. It wasn't anything that I had to go and rewrite protocols, retrain people or anything like that. So I had that experience of living out my core values and brand and culture. Everything, all that would be summarized in the word culture. Whereas when we bought the second location was a 70-year family practice. So it's been around. The father had done it for 30, 40 years and then sold it to his daughter. And then we bought it from her. And so you're coming into a practice that it's been in a community for 70 years. That's the complete opposite of that. So the challenge for me was basically like, how do you one, scale just based upon cost of goods, based upon help, based upon kind of the operational structure. And what I realized, like I said, I'll go back to what I said before, this could be just my ineptitude at scaling, but what I realized is when you go to 1 to 2, you're really not scaling, you're basically just doubling, if that makes sense. You're basically
Yeah.
doubling your work. There's not a lot of like benefits at 2 versus 1. I could see in our world, if you go to 3, 4, 5, I could see that you could spread out labor and some costs there. I think there'd be benefits to that. But right now, from what I've found in my model, 2 has been just doubling my work. So that's been a challenge. But also, I'm a big proponent of culture. I mean, we have the Book Nerds podcast that Dr. Brianna Rue and Aaron Warner and I do. And we talk a lot about like business, entrepreneurship, culture. And so I love to talk about like how do you create an organizationally healthy practice, healthy organization. And that's been the biggest challenge is integrating what we created in our one office to being accepted, not just accepted. That's the first thing, people have to accept that new culture, but also to be embraced and then lived out. And so that's like what I just came from one of our team meetings down in our Iowa office, every Tuesday morning from about 8 to 9:15. And so was a major topic of our conversation of talking about, this is who we are. This is the most important thing about us. This is why we exist. And then this is what's most important now. And just making that extremely clear among the team and then getting people in the right position, the Jim Collins quote, right people on the right share on the bus or whatever. I guess I kind of butchered that, but you get the point, right? The right
Yeah,
people
yeah.
on the bus. That's the challenge that I've found for sure in the last 2, 3 years between the two.
Yeah, speaking of the no, that's great. Thank you for sharing all that because I think it's always helpful, right, to share either the challenges, the failures, the zigs instead of all the zags, right, in the whole process.
Yeah.
And sometimes we listen to these things and we're like, oh, this guy's got everything figured out all the time, and like I'll be the first to tell you, like I don't, and it doesn't sound like
Yeah.
you do. I mean, none of us really do,
Nope.
right? So we just like to bring that to the forefront, but. Yeah, the Book Nerds podcast was interesting. I mean, is interesting. I mean, the thing I love about it is that you all three are optometrists and in it, and you're taking I mean, you're talking, it's not just a regular book talk. You're talking about how you guys are actually implementing things in your own practice. And I think like, I hear a lot of people like, oh, I read, 50 books a year, a book a week or whatever it is. I'm like,
Yeah.
well, how is that translating to what you're doing like in real life?
Hmm.
Like books are
Right.
great. And I'll be honest, I used to be one of those guys, not a book a week, but maybe like one or two
Me
a
too.
month, right? And so it was like,
Hmm.
and it was like great. And I was reading it because it was referred to me, or I was reading it because my friend was reading it and they really loved it. But we weren't, sometimes we would do stuff, but it wasn't like enough, I felt, to really, so like I started to get a number of years ago a lot more intentional about books I sought out. And then it's always that application and figuring out how, because like we're not talking the books I've heard you guys talk about so far and the books I'm talking about on my book list, they're not industry specific, right? So
Right,
they're business, I mean, they're business specific, business leadership,
right,
but there's always a translation into like your industry and your, and furthermore, your practice,
right.
right? So I think it's a great dynamic with the three of you kind of bringing different perspectives to that, but all in your industry. How did that come to be? And what have been some of the bigger insights, I guess you guys have taken away from that process of doing that work?
Yeah, well, how it came to be is I've known Aaron Warner for a few years. We've worked on several projects within Vision Source, creating practice protocols and those things. And he and I had talked a lot about specific books that we were reading. And I've always just been kind of a book nerd. Like, to be honest with you, I'd probably be happier if I was just like a librarian. I mean, I love my job and I love optometry and that, but I just really enjoy reading. I enjoy discovering insights and knowing about and offering and sharing good things to people. That's kind of my heart. But he had Brianna on a podcast, maybe it was like a year and a half ago or so, and she started breaking down, let's see here, maybe it was Buy Back Your Time or All It Takes Is Gold. Anyhow, they were having a discussion, and I remember where I was. I remember I was actually in this room. This is also doubles as my workout room that I'm in right now. So it doesn't have that pretty of a background all the way around. But I was working out and I was listening to the conversation, and Brianna started breaking down like exactly what she was going to do at her practice based upon what they were talking about. And so I texted him immediately, Aaron. I just said, Aaron, Brianna, like, she's really insightful. We need to get on a podcast. Like, the three of us, we should start breaking down books like that, because I think that would be super helpful
Yeah,
for our colleagues and selfishly for myself, right? Because
right.
sometimes I'll read a book, just like you said, I'll read a book and I know it's really good. And I know that there's some things that could help me there, but I just move on to the next, or I get busy. And
Mhm.
so in a sense, the Book Nerds Club is kind of it's self-serving for the three of us, because we get to read and discuss good books and hold each other accountable.
Yeah.
But some of the insights that we all take away that we've found by just reading more good books is that I think we tend to, as optometrists, we tend to think that our profession is kind of different, is unique, and doesn't have some of the same challenges that other run-of-the-mill businesses do. But the reality is there really isn't anything different. Like, our businesses take really good leadership to make them work really well. It takes a good, clear core, mission statement, core values. It takes good, leadership in terms of getting the right people on the bus, like I said before. And so a lot of the productivity principles, the operational principles, the entrepreneurship, all those things that we read about, they're all so applicable to our lives in optometry. Yes, we're clinicians as well. We're not only business people. And I don't really wrestle with personally, like, whether I'm a entrepreneur or a business person or a clinician. I don't get caught up into that. I know some people well, I'm a clinician first, then a business person. Great, that's fine. But at the end of the day, we still have to run profitable businesses. And I think the uniqueness of that podcast too is that each one of us are practice owners. Also, each one of us are big readers, and we all kind of have an entrepreneurial spirit about us. We each have kind of our own side gigs that we do we have our side work that's beyond practice, development, that
Mhm.
helps other optometrists in some way. So I think that's the value that we bring to it. So it's been super fun, and I appreciate you bringing that up.
Yeah, yeah, you bet. Well, like I said, I'm a fan of it just because the implementation aspect and the perspectives, and it's just fun to listen to as well. But I mean, it's a usually a lively conversation you guys are having, and yeah, so I think all of that is great. Last thing before we go, because I know we're running up close to time, and I definitely want to respect your time. But I ask everybody, maybe this is something that you've already stated and just want to reiterate or elaborate on for a minute. But sometimes something brand new might pop into your head, and that is simply your best piece of advice you give to others in their journey in independent optometry as a practice owner.
I would say just reiterate what I said before, in that think about the responsibility that we have as optometrists. think about both just the responsibility and the training that we have. And so when I think back at my experience of like discovering, hey, I actually want to be in primary care and I want to do things comprehensively. It all comes back to just having the right mindset. And so it came back to like, hey, my patients are here in front of me and I want to be responsible for them. And I can, but all it takes is just the right beliefs about my training, the right beliefs about myself, and knowing that I'm perfectly positioned and perfectly trained as an optometrist to take care of the totality of my patient's health. And so that's the main thing that I try to preach. Like I do a lot of lecturing on billing and coding and medical management of disease. And I start every lecture with same insight from James Clear's Atomic Habits. And that's beliefs underlie actions and actions reinforce beliefs. And so if we're trying to make any change in our life, we tend to always focus on the action component and we forget about the underlying beliefs. So it's just, if I could leave, the listeners with that, it's figure out what is the belief, what's the mindset that you need to embrace. For me, it was that I want to do things more comprehensively, and then I'm perfectly positioned to take care of my patients, and I want to position myself. For the listener, it might be something different, but maybe it's for dry eye, and they just need to change their beliefs about dry eye that they can actually prevent this condition, or they can actually prevent the changes that are happening for their patients. So it'd be that. It'd just be understanding how mindset and responsibility tends to change everything about us.
Terrific. That's awesome. Thank you so much, Kyle. I appreciate all your time today, and hopefully our paths will cross again here in the near future. Have a
Appreciate it,
great
Eric.
rest of
Thanks so
your day.
much.
You bet.